external occipital protuberance and internal occipital protuberance. Okay, that's internal. Internal means inside. Okay, we done with occipital bone. Okay, let's talk about lacrimal. Where you find lacrimal? Lacrimal means the gland, lacrimal gland, which is secreting tears. And where is this tear goes? Down to your nose, yeah? This is lacrimal gland. This is a small bone, which is I'm pointing. Yeah, that's lacrimal bone. In lacrimal bone, you see only lacrimal glove, which is I'm pointing. A lacrimal groove. What is groove means? Like a canal, small canal, creek. Yeah, that lacrimal gland located here. Yeah, in your eye. And when it's the tear is coming and passing through the groove and enter to your nose. Okay? Okay, let's talk about nasal bone. Nasal bone is only this one, two sides. Okay? And if you see nasal bone inside is like a perpendicular that separated nasal bone in two cavities. Okay? Let's talk about but inside the nasal bone, you see concha, but this is part of the ethmoid bone. Let's talk about temporal bone. Temporal bone is this one, where I'm pointing. Temporal bone has four bone mark or four region or four bone that making temporal bone, okay, which is a squamous part, mastoid part, okay, and pterygoid, which is inside, okay. Okay, let's talk about temporal bone. In temporal bone, you see process, and you see the suture, flat suture, and this one is called a squamous portion of temporal bone. Okay, squamous means flat, which is I am holding. Yeah, it's completely flat. That's what called squamous. Yeah. Okay, let's talk about the squamous portion. What you see in the squamous portion, first of all, you see one pointing. It's called process. Yeah, zygomatic process, because temporal bone is connecting to zygomatic bone, but this process belongs to temporal, but it's called zygomatic process. You get it? Okay. Then mandibular fossa, where you find them? Mandibular fossa, if I hold it like that, and you see the cartilage, yeah? Mandibular fossa, which is the mandible, is joined. The mandible bone is joined with temporal bone. And making what joint? TMJ. Maybe you heard about TMJ joint. Okay? That's why this fossa is called mandibular. This is, I'm holding, this is mandibular, and this is fossa. But this fossa not belongs to mandible, but belongs to temporal. Okay? That's mandibular fossa, which is, I'm pointing now. The mandible condyle is fit here. Okay? Tympanic portion. This is the tympanic portion, which is I'm pointing here. In tympanic portion, you see external, which is out, yeah? Which is, this is external auditory canal. Meatus, we can say, meatus is the same thing like canal. Mia means opening, meatus, yeah? Like a small canals, which is goes inside your ear. That's external auditory, means you're listening, yeah? The inside the wave of the sound is enter from that canal. That's called meatus, external auditory meatus. That's for hearing, okay? And then a styloid process. The styloid process is this one, pointy styloid process, okay? And now we finish with the two portion. Now let's talk about mastoid portion. That's the mastoid, which is mastoid bone. Yeah, I'm talking about mastoid bone. The mastoid bone, this is called mastoid process. It belongs to that mastoid portion, mastoid process. And the mastoid air cell is located inside, which is invisible. You can't see it. Okay, and they are receptors for the hearing. Yeah, this is a little bit tricky. Let's talk about a stylomastoid foramen. Now you know the mastoid bone, and you have a styloid bone, yeah, which is we go over. Now, where is the foramen located? Between. I'm pointing. That's the stylomastoid foramen. The foramen which is located between both of them. Okay, let's talk about the petrosus. Petrosus means the hardest part, hard bone, like a stone. Yeah, that's called petrosus. When I'm holding, it's so hard. That's your nerve where vestibulocochlear located. Yeah, it's safe. The ear vestibulo, which is nerve 8. Okay, but remember we talk about external auditory meatus. Now another meatus here, the nerve coming out. The nerve 8 is enter the ear, and this is internal auditory meatus, which is located in the petrosus portion. Okay. Let's talk about jugular foramen. Jugular foramen also belongs to that temporal bone, which is the biggest to jugular. The jugular nerve is passing through that to jugular, okay, which is I'm pointing. And you can see from back, see, between two condyle, the two sides of condyle, occipital condyle, which is I'm pointing now. Okay, and another foramen, which is, and I'm holding that, which is called carotid foramen, which is you can see it from here. This one, but it's hard to see. That's two carotid foramen. This is the carotid foramen, which is I'm pointing. That's the one laceration. Yeah, here. I'm sorry for that. Yeah, this one. Okay, two carotid. That's jugular, that's carotid. Okay. And foramen lacerum. What is lacerum? Means something you tears. Foramen lacerum is this one. See the laceration? The laceration, foramen lacerum. Here, foramen lacerum. Okay, I'm pointing to laceration. Okay, now we're done with temporal bone. Let's talk about a sphenoid bone. Oh, that's my favorite bone. A sphenoid bone, like butterfly bone. Yeah, look, the butterfly. The butterfly has small wings and greater wings. Let's talk about a sphenoid. First of all, you see a sphenoid sinus. That's the invisible. That's inside the sphenoid bone. Okay, you cannot see it. But the sphenoid bone in the middle is called sella turcica. Sella turcica, which is you sit on the horse, yeah? Turcica, tarsal. That's the whole thing is called sella turcica. But what do you see in sella turcica? Okay, let's talk about that. Hypophyseal fossa. Oh, this one. Hypophyseal fossa. the important gland is called pituitary gland, or pituitary gland, also called hypophyseal gland, that reside in this fossa. And most of the time, the brain cancer is arise in that hypophyseal gland. Okay? And then we have dorsum. Dors means back of the cella. This is dorsum cella. Dorsum cella. Okay? And then we have anterior two process. Yeah? Where you find that two process? This is anterior, and this is posterior. Yeah? Anterior, and posterior. It's called anterior and posterior clinoid process. Clinoid process. Okay? Okay, let's talk about the wing. That's the greater wing. Okay? And that's the laser wing. See the laser wing? Small wing. Yeah? Then under the laser wing, I'm pointing one foramen opening. This foramen is called optic foramen. See the optic? Optic means eyes, yeah? The optic nerve passing through that foramen. That's how I'm pointing. If I put this here, now you see I'm pointing, opening under the wing, laser wing. That's optic foramen. Optic nerve passing, which is from your two eyes, the transfer. Okay. Foramen oval. There are three important foramen in the occipital bone. I'm talking about these three. Yeah? 1, 2, 3. Okay? The foramen oval is here. It's like an oval. You see the oval? Okay. And another foramen is called a spinosum. A spinosum means a small one. Yeah? That's 2. Spinosum, tiny, small, which is you can see from out. That's spinosum, and the other one is oval, yeah, which is, see, that's a spinosum. Another foramen on the top of oval is rotundum. See, it's like round. See, rotundum, round. Okay, round foramen, rotundum. Remember, the oval between rotundum and spinosum. Okay? Don't mistake. That's the oval. It's like an oval. And round is rotundum and spinosum. Okay? Let's find the rotundum where it goes. It goes there. See? Okay. Supraorbital fissure. Superior orbital fissure. Superior orbital fissure is this one. Yeah, superior orbital fissure is, oh yeah, I found them. Here is under the wings. Yeah, when we see orbital is inside cavity, orbital cavity. See? Now you can see from here. There are 2 of them, superior and inferior fissure. But the superior belongs to the sphenoid, yeah, which is located under the wings, laser wings. Now you see 2 of them. 1, and I'm pointing another one. You see? It's entered to your both eye, both orbital cavity. Okay? That's called supraorbital or superior orbital fissure. Okay, now pterygoid process. Oh, that's my favorite process. That's the leg of the butterfly. Yeah, that's called pterygoid process. And remember when the butterfly has leg it's sitting on. Yeah, that's pterygoid process. Okay, that's pterygoid process. Okay, let's talk about, since we are pointing the pterygoid, but one small bones between 2 pterygoid is called vomer. Yeah, that's called vomer. Vomer, you can follow in the front of nose, and this is also vomer in the front. That's vomer. Okay, that perpendicular plate is joining to that. Okay, let's talk about ethmoid bone. Ethmoid bone in the top of the, or between frontal bone. Yeah, the between frontal bone is ethmoid bone, which is I'm pointing here. Yeah, pointing. And what you see in ethmoid bone, cribriform plates. These are called plates. It's like a plate that has small holes on it. You cannot see the holes, but it's there. Okay, cribriform plates. Why is this hole so important? The first nerve is called olfactory nerve is passing through that and enter your nose, yeah? Or from nose has receptors that transfer the smells. Olfactory means olfaction, means smells. That's why you smell, you recognize a smell. Okay? That's the cribriform plates. Okay. On the top of cribriform is one pointy bones. It's called crista galli. That's the crista galli, tiny little bit. Okay? And then you have if you see the point, the perpendicular, but that you cannot see from inside, but you see the perpendicular plates is entered to your nose, which is, I'm pointing here. This one, perpendicular, yeah? Perpendicular plates dividing your nasal cavity to two portions, right and left. Okay, and this perpendicular is very important because sometimes when somebody punch you, this perpendicular can broken and your nose deviated in the right and left. Okay, another important is lateral masses. Lateral masses or concha, yeah? Concha or concha is both. Concha, see, they are lateral masses, two sides of your nose. These are. You cannot see the superior, but you can see middle concha and inferior concha. And under the concha is meatus, which is the turbulent the air. Okay? Inferior nasal concha and middle nasal concha. And ethmoid sinus you cannot see inside. Okay? That's invisible, the sinus, but it's there. Let's talk about zygomatic bone, cheekbone. This is your cheekbone, two cheekbone, right and left. Yeah, this is like a rectangle bone. Okay, and zygomatic bone, you see, temporal process. Remember we said the zygomatic process belongs to temporal. Now zygomatic has process pointing to connecting to the temporal bone. This is zygomatic, a temporal process, okay, for zygomatic bone, okay? And you see the zygomatic facial foramen, yeah? Here, zygomatic facial foramen, one of the branch of facial nerve center. Okay, let's talk about maxilla. The maxilla is this bone, yeah? Maxilla, or upper jaw. You have two jaw. Lower jaw, which is mandible, and upper jaw, which is maxilla. What do you see in maxilla now? You see, remember I said the orbital cavity made of few bones, and one of them is maxillary or orbital plates, yeah? That's orbital plates. I'm pointing that, orbital plates. Okay? And then you see an infra means down, yeah? Orbital means the foramen located in the bottom of orbital cavity. But it belongs, you remember we had two supraorbital ridges or foramen, but this is infraorbital foramen. Okay? And then maxillary sinus, which is each bone has their own sinus, but you cannot see it inside. Okay? Maxillary alveolar margin. Alveolar margin, alveol means teeth. Your teeth is enter that margin. That's what your teeth is making that margin. Your teeth is pointy, yeah? And that make that maxillary margin or alveolar margin. These are on point. Okay. And then this is the zygomatic from outside, this bone marking. Let's do the inside. This is the zygomatic bone from inside this portion. Okay? What you see from inside is important foramen, which is called incisive fossa. Incisive fossa, which is I'm pointing. Okay, incisive fossa. Or also called anterior palatine foramen. Yeah, it is anterior. It's located anteriorly. That's why anterior palatine. This is which is that, yeah, palatine bones, like means that foramen located in front of palatine bone. Yeah, that's what it's called anterior palatine foramen. This is, and then palatine process. These are palatine process. Yeah, these are palatine process. Okay, median palatine suture. What is median means? In the middle, yeah? That suture, this one. That separated palatine bone in two. That's suture, yeah? Two palatine synostomes. And then greater laser palatine, which is, this is the greater and this is the laser palatine. Greater and laser palatine. Okay? Palatine foramen. Oh, we're talking about foramen. I didn't see that. Yeah, greater and laser. This is means the bigger and the smaller palatine foramen. Greater, which is big, and that's laser in the bottom. Bigger, bottom. Greater laser palatine foramen, which is this palatine. This foramen belongs to palatine bone. Yeah, that's the palatine bone. That's greater and laser palatine foramen. Okay, we done with skull. Now we're talking about lower jaw. This is your lower jaw called mandible bone. Okay, mandible bone. If you see the mandible bone, the two sides looks like hallway. Yeah, this is rami. See, I'm pointing to right and left. That's called rami. Rami. Or Ramos, yeah? Rami, Ramos. Angle, where you find the angle? Now you see that. Angle once in another line. That make angle. This is the angle of mandible, okay? When I'm holding, that's the body of the mandible in the front, yeah? And this is the angle, and this is the Rami. You got it? Okay, let's talk about two important process, which is, the first one is called mandibular condyle. See, it looks like condyle. Remember that condyle in this bone? It looks like that. And where this condyle goes, inside there, remember we said that fossa mandible? It joined with fossa mandible, or called mandibular condyle process. Okay? Chronoid process. Chronoid, this is mandibular. Chronoid process is in the front and condyle in the back. Okay, that's chronoid process. And then mandibular notch. Mandibular notch located between both two process. Notch, yeah, which is, I'm pointing, notch. And then we talking about mental foramen. That's mental foramen, yeah. When you go to the doctor and you have toothache, or the doctor remove your teeth, they they put anesthesia. Yeah, the one of the nerves enter here. Okay. Okay, alveolar margin. Again, remember we had alveolar margin in the maxillary margin, bone? Now we have alveolar margin, the same thing in mandible. Okay, these are alveolar margin. Okay, now you see oblique line. This is your oblique line. When you follow oblique line, when you go up, you see one foramen, which is called mandibular foramen. I'm pointing. Okay, oblique line, and then foramen. Okay, and mandibular mylohyoid line is located here. Mylohyoid line on the outside. Okay. Okay, we finished with mandible bone, but we don't talk about hyoid bone. Hyoid bone is inside, invisible. Okay, hyoid bone is the bone that connecting some small muscles is connecting to hyoid bone. We're talking about when we do axillary. And the ear ossicles is inside the internal ear, which is internal inside that petriculate. We don't see it. Okay, you can cross out that. Okay, let's talk about the fontanella. Fontanella, you can't see it, but it's close. Fontanella very here between bones, yeah, in the small babies, which is very important, okay? You cross out. Okay, we finish with the skull bone. Let me put away that skull bone here.